Unit VCS02, the role, remit and responsibilities of a suitably qualified person. The aims and objectives of this video are that you will understand the role of an SQP, the role of AMTRA in relation to SQP training, the CPD obligations that are required of an SQP and why it is important, and also the role of an SQP in practice and their professional responsibilities. So what is a suitably qualified person? The term SQP is used in the legislation of medicines in relation to the prescription and supply of medicines. They can be either an RQP, and this is a registered qualified person, such as a veterinary surgeon registered with the RCVS, or a pharmacist registered with the Royal Pharmaceutical Society of Great Britain, or an SQP, and this person is a suitably qualified person and they are registered and have done their training with AMTRA. So who are AMTRA? AMTRA is currently the only professional body for SQPs. All SQPs have to be registered with them and pay an annual registration fee. They also monitor the CPD or continuing professional development of SQPs in order to make sure that they are up to date and relevant. Question: can you hazard a guess as to what the term AMTRA stands for? AMTRA stands for Animal Medicines Training Regulatory Authority. So they are a regulatory body, and as we've already said, they deliver and then maintain the register of SQPs. Registration. SQPs must register with AMTRA as an SQP trainee. Please note that no previous qualifications are needed. SQPs aren't only relevant to veterinary practice, they are also relevant to pet shops. So for example, sites such as companion care may have more than one SQP located within that sort of building, especially if they have a pet store housed within there as well. Trainee SQPs can access online training, and they must complete examinations at a college that offer the exam. And at the moment, Harper Adams is the university that are affiliated with AMTRA to support SQP training. The SQP trainee must pass at least one or more species-based exams, and this helps to determine the animals that they can prescribe medications to. Please note we don't just have small animal SQPs, we can also have large animal, equine, and also SQPs that are relevant to small furries or exotic patients. Now, if RVNs wish to become an SQP, then we do have recognition given to the previous training and study. This can only be brought about if the RVN produces a veterinary nursing certificate to have credit given for that prior learning. And what that would then mean is that they would be required to sit a shortened assessment, and that would mean that they could become a CSQP. There are different SQP categories. So all SQPs have to pass a base examination, which covers legislation, basic anatomy and physiology, and basic disease challenges. In addition to this, there are species modules. So we have farm animal, equine and companion animal. So in order to supply medicines, the SQPs must have passed the relevant species group module as well as the base exam. So they will have different qualifications and different titles after their name. RSQP relates to all species groups. ESQP relates to equine and companion animal only, and CSQP relates to companion animal only. So what can an SQP do? An SQP can mentally, orally or in writing prescribe a POM VPS medicine for a client for which they don't need to see the animal. They cannot diagnose disease but can identify infestation such as that of a flea infestation. They cannot treat disease, they can only advise on prevention and control of that disease. Please note, in relation to diagnosis and treatment of a disease, that would fall under the remit of a veterinary surgeon. Many of the medicines in the VPS categories have preventative uses, such as antiparasitic medicines, so flea and worming treatments. The SQP is required to ensure that the medicines they supply fall under the following categories: POM VPS, NFA VPS, and AVM GSL. These medications, when prescribed, must be appropriate for the animal and its circumstances, and that of the owner and their circumstances. The SQP also has to be confident that the owner is competent to administer the medication, so advice must be given or a check made. Question. Think about some examples of when someone may not be competent to administer medication. Make a note of these examples and upload them onto your OneFile for your veterinary educationist to mark, to review and assess your understanding. To summarise, SQPs can prescribe the following: POM VPS, and they can also supply them, and they can supply NFA, VPS and AVM GSL medicines. They can only do this from authorised premises and only from the animal category that they are trained and registered for. So for example, when we talk about authorised premises, we could be talking about pet shops, veterinary practices, and as we said, they need to be competent in relation to the species that they are prescribing it for, so can only do it from that category. The SQP must work according to a code of practice that is issued by the Veterinary Medicines Directorate, the VMD, and distributed by AMTRA. Question. What type of category of medicine can SQPs not prescribe? Have a few moments to think about this. Think back to your categories and the letters that stand for who can prescribe them. Okay? Hopefully you got the answer POMV. That means it is a prescription-only medicine, but only veterinarians can prescribe them. So an SQP would not be allowed to prescribe such a medicine. In summary of today's session, you should now understand the role of an SQP and the support that they can play within a veterinary practice or pet shop, for example. The role of AMTRA and who they are and what they do. Their CPD obligations and why this is important. And also what an SQP can do in practice and their professional responsibilities and remit.